Why are Medicare Part D premiums going up? That's your prescription drug coverage. We're going to talk about some of the reasons that might be in today's video, so please stay tuned. And I'm going to give you some ideas of what you can do to help offset some of this cost in 2025, so make sure you stay tuned till the end. My name is Jamie from meetjamie.com. I'm a licensed insurance agent helping people understand the Medicare program and connecting them with the coverage that fits their needs. Let's dive into today's videos. If you like videos like this, please subscribe to the channel and hit the like button. So let's start off by talking about 5 reasons Part D premiums might be rising. There are a lot of factors that go into the premiums on insurance plans. So I'm going to talk about 5 of them, but this is not the full list by any means. So there could be other factors involved in this, but let's look at just 5 today. So first of all, rising prescription drug costs. So pharmaceutical companies have been increasing the prices of many medications, which in turn impacts the rates or the costs for Part D drug plans. Higher drug prices means sometimes that insurance companies need to charge higher premiums to cover these costs. Next would be changes in Medicare regulations. A lot of people don't realize this, but there are always rules and regulation changes happening with Medicare, and this can impact the price of premiums on the plan that you have. For example, we're going to talk about this in a little bit too, the elimination of the donut hole. That is going to affect profitability for many insurers, and so sometimes what happens is they pass these costs on to the beneficiaries. Next is increased utilization. As more people use prescription drugs, especially with the aging population, insurers face higher overall costs, and increased demand for medication can lead to higher premiums. Next is the word that we're probably all sick of hearing, and that is inflation. General inflation, in other words, throughout the economy, can increase administrative costs for insurance companies, and these increases are often passed along to consumers. And then finally on this list, I just want to talk about plan competition and structure. So Part D drug plans vary in their formularies. The formulary is just the list of covered drugs, co-payment structures, and provider networks. Insurers may adjust their pricing strategies to remain competitive, especially in markets where the cost of offering coverage has risen. Again, there are multiple factors that contribute to rising insurance premiums that you have to consider. Next, let's talk about one of the biggest changes, and that is the Inflation Reduction Act. This was passed under the Biden administration in 2022. What did this do to Medicare, specifically Medicare plans? Well, let's talk about that. One is that they passed a law that will allow the government to negotiate for the price of drugs. So this will start in 2026. Medicare will be able to negotiate prices for certain high-cost prescription drugs. While this should reduce costs in the long run, insurers may be adjusting their pricing now in anticipation of future changes. Next, capping insulin costs. So you probably heard on the news about how insulin was going to be capped for Medicare beneficiaries at $35 a month. While this benefits consumers, insurers may have increased premiums to cover the potential loss in revenue from reduced insulin copays. Elimination of the donut hole. So I mentioned this earlier. So the Inflation Reduction Act will fully eliminate out-of-pocket costs in the catastrophic coverage phase, commonly known as the donut hole, by 2025. And so what the government is trying to do is cap the out-of-pocket costs total for Medicare beneficiaries at $2,000 annually. As this change is phased in, insurers might be adjusting premiums to spread the cost over time. Anytime there is movement of money around, it has to be made up somewhere else, and many times that's in increases in premiums. Also, inflation rebates. So starting in 2023, drug manufacturers must pay rebates to Medicare if they increase prices faster than inflation. This aims to reduce the pace of drug price hikes, but some insurers might preemptively raise premiums to mitigate any uncertainties around manufacturing pricing strategies. So, this is the main reason you're here, the main question that you have. What can you do about this? Because the reality is that when you are using Medicare, you're using a program connected to the government, and there is a lot of things that are not in your control. You just don't have control over those things. But there are a lot of things you do have control over. And that's what we want to focus on, is what can you control and what can you change. So, right off the bat, review and compare plans annually. So the open enrollment period, which runs from October 15th through December 7th, is your opportunity to compare and switch Part D drug plans. Drug formularies, premiums, and out-of-pocket costs vary between plans, so it's crucial to shop around. And you would be amazed at how many people don't shop their coverage every year. And I want to just mention too, this is for Medicare Advantage and Part D. If you have a supplement plan, you just pay that premium and it rolls from year to year. So one of the ways that you can shop is on Medicare.gov using the Medicare Plan Finder. These plans will be available starting October 1st. You can use that tool to compare Part D plans based on your specific medications and preferred pharmacies. Some plans may offer better coverage for your current prescriptions. Next, switch to generic or lower cost alternatives. You should always be talking to your doctor about generics. Generic drugs are often significantly cheaper than brand name medications. Ask your healthcare provider if a generic equivalent is available. You should also look at formulary alternatives. Some plans have tiers of drugs with different copays. A lower tier drug in the same category as your current prescription could save you money. Use preferred or mail order pharmacies. You want to make sure that you're getting your drugs from a preferred pharmacy network. Some Part D plans offer lower costs when you use pharmacies with their preferred network. Switching to a preferred pharmacy can reduce out-of-pocket costs. Also, using mail order pharmacies. Many plans offer discounts for medications filled through a mail order pharmacy, especially for a 90-day supply. Next, you can apply for Extra Help, low income subsidy. There's things called the Extra Help program. If your income and resources are limited, you may qualify for the Medicare Extra Help program, which can significantly reduce your Part D premiums, deductibles, and copays. You can apply through Social Security. Also, you could consider a Medicare Advantage plan. Some Medicare Part C Advantage plans include prescription drug coverage. In some cases, these plans can offer lower premiums or better drug benefits than standalone Part D plans. However, be sure to carefully compare the overall costs and coverage of any Advantage plan you're considering. Also, take advantage of manufacturing or pharmacy discounts. Some drug manufacturers offer patient assistant programs that provide discounts or free medications. Check with the drug manufacturer to see if you qualify. Pharmacy discount cards. Some retail pharmacies and services like GoodRx offer discount cards that can provide savings on prescriptions even when using your Part D plan. Next, monitor and plan for the 2025 out-of-pocket cap. Again, the Inflation Reduction Act introduces a $2,000 annual cap on out-of-pocket costs starting in 2025. If you anticipate high prescription costs, planning for this can help reduce financial strain once the cap is in place. Review and track your medications. Regularly review your prescriptions. Work with your healthcare provider to regularly review your medications list. Discontinuing unnecessary medications can help you reduce your cost. Medication synchronization. Some pharmacies offer a service that allows you to refill all your medications at the same time each month, reducing the number of trips to the pharmacy and potential copays. And then finally, you can contact your state health insurance assistant program for free Medicare counseling in your state. So again, if you're wondering why your Part D drug plan premium is going up, there are multiple factors, but there are some things that you can do. If you have questions about this, you can reach out to me again through my website, which is just meetjamie.com. If you like videos like this, again, please subscribe to the channel. Hit the like button. If you have questions, leave a comment. And if you found this helpful, maybe share it with a friend. Thanks for watching. Have a great day.